Good evening, everyone, and welcome. My name is Sevan Shedikian, and I am the Program Manager for UCLA's Operation Armenia. Tonight's webinar, titled Building a Sustainable Future, Universal Healthcare in Armenia, is brought to you by our devoted team at Operation Armenia, which operates under the umbrella of the Promise Armenian Institute at UCLA. Before we begin, we would like to go over a few housekeeping items. This event is being recorded to be used for future viewing, and the chat will be disabled for the public. If for any reason this webinar disconnects, please just connect right back using the same link. Also, we will be utilizing the Zoom webinar Q&A function. We invite you to use this function on your Zoom toolbar to submit any questions you may have by typing it in the Q&A window. We will try to address as many of the questions during the webinar. And at the conclusion of our session, we will drop a link in the chat. Click on the link to sign up and receive all the latest updates from Operation Armenia. We are thrilled to bring you an engaging discussion that we hope sparks thought and insight. It is with great pleasure that we welcome our distinguished panelists, Dr. Adanna Chukwuma and Dr. Lena Nanushyan, to join us this evening. Dr. Adanna Chukwuma is a Senior Director at Visa, where she drives alignment between digital payment growth and social impact, using data science and strategy, and facilitates investments at the intersection of healthcare and the digital economy. Prior to this, she was a Senior Health Economist at the World Bank Group, where she advised senior policymakers, including Deputy Prime Ministers, Ministers of Health, and Ministers of Finance, and build cross-sectoral partnerships to drive complex health financing and service delivery reforms. Dr. Chukwuma obtained a Doctor of Medicine from the University of Nigeria, a Master of Science from University of Oxford, and a Doctor of Science from Harvard University. Dr. Lena Nanushyan holds a preventive medicine physician qualification from Yerevan State Medical University after Mkhitar Heratsi. She has a master's in public health from the American University of Armenia. Dr. Nanushyan has had an exhaustive professional history. She has served as an expert for the Standing Committee on Health under the National Assembly of the Republic of Armenia, the head of Foreign Relations Department with the staff of the Ministry of Health, and was the country coordinator for the Joint United Nations Program on HIV and AIDS. In 2021, Dr. Nanushyan was appointed as the first Deputy Minister of Health by the Prime Minister of the Republic of Armenia. Guiding our discussions this evening is Dr. Shant Shekherdimian, co-director of UCLA Operation Armenia and associate professor of pediatric surgery at UCLA. Unfortunately, Dr. Alina Dorian won't be able to join us this evening. Our panelist and moderator will shed light and help us define, explain, and tell a story of the universal healthcares. Now, before we move on, I want to make a quick disclaimer. Please don't judge me by this slide. As an educator, I know this is not a good slide, but the idea is it's all very overwhelming. And in preparation for this webinar, I wanted to start off with a standard definition of universal healthcare. And the simplest I got was this. If you were to search for the definition online, you would most likely encounter something as wordy as what's on this slide. So hopefully, with tonight's discussion, we will be able to really tease out the principles, the ideas behind universal healthcare, and what it really means to the people. At this time, I will stop sharing my screen and turn it over to our panelists and moderator.
Evangeline, thank you very much for the introduction. Do I see correctly that we may have lost Deputy Minister Nanushyan?
Yes, we did.
Okay. Looks like we're getting her reconnected, so we'll give her 10 seconds here and we'll get started. In the meantime, welcome everyone. Thank you very, very much for taking the time this evening to join us. I suspect most of us are joining from the West Coast, but unlike the rest of us, our two panelists are actually taking time out of their very, very early mornings in Armenia and very late evening on the East Coast. So especially thank you to you two ladies. However, knowing how passionate both of you guys have been on this topic and the implementation of universal health coverage in Armenia, we had no doubt that you would be joining us no matter what time this webinar took place. So thank you very much. We're going to try something a little different today. Rather than having you to present or have slides, we thought we would do this a little bit more in the form of a conversation. So please feel free to interject before, after, or during I'm asking a question, and let's get started here. So Sevan just showed us a slide that attempted to simplify and provide a simple introduction to universal health coverage, and even that was a very difficult and wordy slide to look at. So I wanted to ask each of you the following question. And one other thing I'm going to try to do today is just sprinkle a little bit of insight and some anecdotes of some of our experiences having worked together in Armenia. And so I'm going to start with the following question for you, Lena, someone who actually preaches what she says. And I know that every Saturday morning, on the one day that you have off from work, you get up and you walk around several kilometers because you want to also practice the healthy living that you are so passionate for. So the question is going to go as follows. You are walking down the streets of Yerevan, and an old lady, a citizen of Armenia, comes up to you and says, Lena Nanushyan, I keep hearing about this concept of universal health care, universal health coverage. What is this all about? I go to my doctor, my relatives maybe send me some medications. I get health care. So what is this all about? Can you explain this to me?
First of all, I wanted to thank you, Sevan, for organizing this meeting. This is a good opportunity for us to interact with you and to present our experience. So actually, Shant, I'm having in my life, in everyday my life, such situations when people are asking me that question, and I'm trying to be, to explain in a way that they will take and understand. So I'm saying that when you are having your medication paid from your pocket, when you are paying for diagnosis, or when you are going to hospital and paying for the operation and other services, so this all will be accessible for you at the time when you will need it. So this is the way I'm trying to explain them what means the universal health coverage.
So it's taking what we have, or what some people have and others have maybe more, while others have less, and it's providing it to everyone anytime they need it, whatever they need, so as to assure better healthcare or healthcare at all times. Is that a correct summary of what you were explaining here?
Yes.
Yeah.
It is correct way you are describing, but usually people do not understand when I'm talking in that way.
Great. Just to then now sort of toss it over to you, Adanna. Adanna, I know that you have not only in Armenia, but in many other countries. Perhaps maybe we can divide the population or the two target groups for having these types of conversations into the population and then the policymakers. But it seems to me that many of times, and correct me if you're wrong, you've also had to explain universal health coverage or universal health care to policymakers, the overwhelming majority of which don't understand anything about healthcare and may have very inaccurate assessments of what good healthcare is, or what acceptable or high quality healthcare is. They may think, without any fault of their own, that good healthcare means more healthcare, or it means more advanced healthcare. And so, as you meet different policymakers from all around the world, and maybe specifically for those that are not the ministers of health, but the other policymakers, the ministers of economy or finance, or the prime ministers of the world, how do you explain universal health coverage to them?
Thank you so much for this discussion. So there are a couple, when I'm explaining universal health coverage, there are a couple of key points to make. The first is that word universal. It's inclusive of everyone, right? We walk into many countries where there are groups of the population that have coverage and the others that don't. And so the first thing I explain is we're having a conversation about everyone. The second piece is that this thing that is universal is access to quality care. And the way we define this globally is that you're able to use essential services. And this word essential then becomes tricky, right? Because there is no country on the face of the earth that can, for everyone, provide every single service. So when we say you can use essential services, that involves choices that we have to make. But those services have to be of high quality, right? And then the final piece, so everyone can use essential services of high quality, but the last piece is really important, without the risk of financial difficulty, right? Because there are countries around the world where the government makes available through some means, or the private sector makes available through some means, lots of services, they are of sufficient quality, but there's a big chunk of the population that cannot receive those services because in receiving them, they are impoverished, or they have to give up spending for education or for something else. And so when I'm explaining this to policymakers, we try to make those points. It is universal. It is, you are able to use essential services. Those services are of sufficient quality to maintain your health, and they don't put you in financial difficulty. That is now sort of the definition of universal coverage that's within the Sustainable Development Goals.
Great, thank you. So both of you, I think to a layperson and a policymaker, have described something that everyone should be jumping right on. Yet we understand that not only in Armenia, but practically anywhere else in the world, the path to achieving universal health coverage is very long, very challenging, and with a lot of barriers and obstructions on its way. And so maybe with this question, if we can start with you, Adanna, and ask you to highlight why it is that we are unable, or it takes so much time to sell something that in principle sounds so good and would be in such a benefit to any country, generally speaking, with you already having alluded to one in terms of the finances associated to it, and that money has to come from somewhere, some other sector. And then maybe after that, we can transition back to Lena and ask for some specifics about the challenges in Armenia that she is experiencing on a day-to-day basis. So Adanna, maybe we can start with you now.
It's a great question. In many of the countries I work in, I've worked mostly in middle-income countries. These are countries that they've done what I call first-generation reforms, right? So when you're a child and you have this one-off, cough, fever, you have an upper respiratory tract infection, we figured that kind of thing out. You have antibiotics, you have one touch with the doctor, there's, painkillers, and you're okay. If you're a woman and you're pregnant, there's 4 visits to the hospital. And so in some of those countries, there's been a measure of success. Over the years, they have seen life expectancy increase as child death has fallen, as maternal health has improved. And so many times when we come into those populations, people are living long. They're just living unhealthy lives. And I think that's the first challenge. The first challenge is in many of the countries that are middle income, when you're having this conversation, the urgency of the problem is less apparent with chronic illness than it would be if we were having a conversation about high mortality rates for children, high mortality rates for mothers, which is the kind of conversation I would have in, say, Liberia or Nigeria, right? Having universal coverage. And that's unique, I think, to the kind of country that we're talking about, like Armenia. The second piece is there are many reforms that a Minister of Finance is considering. Universal coverage is really important because it's an important determinant of health. But there are other determinants of health, and beyond health, there are other important ends that a policymaker, in a finance ministry beyond the sector is thinking about. And so often he's making trade-offs. He's making trade-offs between health, education, the social sector, etc. I have found that the most successful ministers of health in my work have been ministers of health that learn to speak the language of Ministry of Finance, right? They can understand, okay, because every minister is coming in there and making the case for the sector. And I often refer to the Minister of Health in Romania that saw through this huge reform that expanded, coverage to the informal sector. And she was lockstep with her Minister of Finance, going back. So we would have meetings in the morning on challenges, and then they would have coffee in the night. And then she tried to understand, why is this hard? How can I understand you? And they'll come back in the morning with solutions, right? So the second piece of this is that it's difficult because there are trade-offs across society. And that is both a financing problem and a political problem. In many countries, even when you can get past the urgency, you need to figure out, how do we finance this? How do we balance it across priorities? And then can the key stakeholders work together to find solutions to something where there is usually no one right solution? Right. So I'll stop after a few seconds now. So when we talk about, using essential services of sufficient quality, protecting you from financial risk, there are many of options that can get you there. The specific option that a country takes determines on specific factors like what was the situation of the system right now, right? For example, if you have multiple payers starting, can you converge immediately, or do you have a path where you converge gradually over time? Things like that, right? So it's, what is the starting point? How much resources do you have? What is the capacity in the country? So because there is no right solution that applies to every context, universal health coverage is inherently both a technical and a political challenge to get to. I'll stop there.
Thank you very much. So now the initial excitement is a little bit brought down because there's a lot of complexities here, and it's not as simple as one may seem. But despite all of these challenges, I am aware that in Armenia we have had some progress towards achieving and implementing universal healthcare, and maybe we can turn it over to Lena so that she can tell us a little bit about the history of priming or preparing the country and ultimately establishing and implementing universal health coverage. Where have the wins been? Where have the successes been? Where are we now?
Thank you, Shant. So I would like to talk about the challenges mostly. So the first one that I wanted to mention is the challenge of preparing the healthcare system for the implementation of universal health coverage. When you are thinking about universal health coverage, you should think all those functions of healthcare system that should be ready to provide or to support the provision of all services that you are planning to provide. And when we were starting this process, we understand that without going through the primary healthcare reform, without considering the increase of quality or working with human resources or digitalization of system or working with other functions, we will not succeed with our aim. And this was the process started before even talking the main principles and ideas of universal health coverage that we prepared. And the main challenge was that you should do work in all directions, and everything should be interconnected, and they should not only bring to some result by themselves, but also support the implementation of each other. For example, if we're thinking about the quality, we have started from the facility licensing requirements. So what are those requirements that we need to be placed that will provide qualified services within universal health coverage? We started to think about the human resources. So what type of programs we should implement, for example, the continuous medical education system, or now we are trying to will be implementing the licensing for physicians, or the quality system for the hospitals, how we can measure the patient satisfaction to understand if we are providing those services that they need or they expect to receive. So one of the biggest challenges is to work in multi-directional programs to which will support the implementation of universal health coverage. And the second challenge, of course, Adanna already talked about it. This is the work with the Ministry of Finance. When you have to work with their language. And of course, it's not easy, and I don't think that the doctors can turn into all those wordings, terms that Minister of Finance is using, because our aim is different from the aim of Minister of Finance. We have aim to protect the health of our people. The Minister of Finance is thinking in another way. And we should all the time do not forget about our aim, what is our aim, and provide all the justifications that we need to make a decision. So the second challenge was that, but fortunately, we have come to conclusion and we have cleared all the questions that Minister of Finance raised, starting from the which are those essential services that Adanna raised, how you have calculated, do you have any protocols, or how you are going to provide quality services, how you are going to have reporting of the system like in digital system, etc., etc. So it's not a one-day work, of course. It became even a routine, your work, when you are going through the questions and providing all the answers. But of course, when you are working in different projects in different directions, you believe that one day they will bring those results that you set up as the targets. Thank you.
Thank you, Lena John. If I can paraphrase or summarize, it seems like a couple of themes are emerging in terms of preparing the system or the country for the implementation of universal health coverage. We need to prime the policymakers, and within that is finding the money. We need to prepare the system, prime the system so that it could provide these essential services at high quality, and maybe we can go back and address that. Is there, and this question could be open to either, is there a role or a need to prime the population, the people, the citizens, for them to be ready, for them to have trust in the system, for them to believe that their investment, because ultimately this needs to be financed and the finances are coming from them, will yield a higher return on investment from what they have right now? Any thoughts about that? Is there a role for readying the population for this, what could be a drastic change in how healthcare is delivered?
I mean, I feel like that's a trick question. So I think I'll start by saying yes. But I think I would be remiss if I don't touch on a very important subject here, because I think often in Armenia, when the subject of engaging the population has come up, it has come up around taxation. And I think it's important to have a conversation about financing here a bit, and then we can talk about engagement. So,
well, let's go to that. That was going to be my next question, but let's switch to that. So go ahead. I was going to give the scenario of
apologies, Shant, for still.
No, this is perfect. This is perfect. So let's dive into the financing. So
yeah,
I know Adanna. Okay, let me set you up here. I know that you have a lot of thoughts about this. I know that you've published papers about this, about financing of the healthcare system in Armenia. So have at it. What are your thoughts? What's the best way to do this? And I know that Armenia has also somewhat evolved in the way we've thought about how to finance it. There's been some previously suggested models, and we've transitioned from that. So obviously, financing of this whole system is one of the most crucial elements. So tell us your thoughts about that. What is your recommendations for Armenia, and what do we do?
Okay. First of all, why is this a central question? So for those on the call who don't know, when we look at the data, out of 100% of health spending in Armenia, about 84% of it comes out of people's pockets directly. Now, that's a big number, but you need to situate it within the global sphere, right? It's higher than the number in places that don't have functioning governments, like Yemen has numbers in the 70s, Afghanistan, right? So if we go back to our definition of universal health coverage, where we say accessing healthcare should not come at financial difficulty, in Armenia, that is not the case. Now, the big driver of paying out of pocket, the big driver is outpatient medicine, right? So think about the person who has hypertension, who has heart disease, right? Who has a recurring need for medicines for the rest of their life, most likely. If you're not a civil servant, you're not among some special groups, you're paying for most of that out of pocket. And if you cannot meet that need out of pocket, you forgo your care. What is the result? The result is that Armenia has a higher prevalence of heart disease than most countries, per 100,000 population, than most countries within the same social demographic profile. So I just need to center, why are we, when we have a conversation about universal coverage in Armenia, going back to financing? It's because right now, the way in which healthcare is paid for in Armenia is inconsistent with universal coverage. Now, we know from the global data, what are the ways to finance healthcare so that you can achieve universal health coverage? The way to finance healthcare is such that you are not paying for healthcare at that very point when you need it. Healthcare is a very unpredictable need. Unlike education, I have a kid, I can say this kid is going to, need to go to primary school, secondary school, university. I can plan ahead, I can start saving, I can start investing. Now, healthcare is unpredictable. You can be a perfectly healthy person, wake up in the morning, have an accident, and be paralyzed for the rest of your life. You might be 60 and you're very healthy. In fact, one of the most sophisticated health systems in the world, the Netherlands, in terms of collecting data for you, their insurance system with their data can only predict 30% of health events. So when we are exhausting everything, there's 30% we know and 70% we don't know. So in Armenia, you're spending money out of pocket. That is driving poor health outcomes. There is almost no way we know to make it predictable for you to plan ahead. So globally, where we are is the right way to finance healthcare is we find a way to contribute resources before you need health services that pay for those health services. Now, why do we contribute? Because there are different needs for healthcare. The rich tend to need less healthcare than the poor, the young less than the old. And so when we put all of that in a pool, on average, we can't predict for you, but on average for the population, we can make it predictable. We call that prepaid financing. So if I haven't lost you completely, let me explain what the recommendation is here. Now, Armenia faces a challenge that is not, I wouldn't call it unique. It's a high informal sector. We have a lot of people in Armenia that work in occupations where their income fluctuates. It's not steady. It goes up, it goes down, it's unpredictable. Now, if you subject those people to a specific tax, in some cases they can pay, in some cases they cannot pay. Now, the global evidence suggests that the right way to finance health services is to put all of it in a pool and make it compulsory. If you don't make it compulsory, healthy people like Adanna won't pay, right? So you have to make it compulsory. So the Adannas pay, Adanna's mother puts into the pool. And then for the people who can't pay, you have a subsidy. So it's compulsory, it is subsidized for those who cannot pay, and it's pooled together. Now, for a country with a large informal sector, you now have to find what are the various means that I can use to put into that pool that fits the financial profile of that country. This is where we go back to the conversation between health and finance, right? Because finance has goals. They have goals, they want to grow formal labor. They want more jobs in industry, etc. And if you put a tax that makes it harder to be formal labor, you're creating incentive to join the informal economy, right? And so our recommendation has always been, do the things we have seen that work in other middle-income countries. Go for broad-based taxes, broad-based, meaning things that cover a large proportion of the population and are able to pool those resources together, mostly consumption taxes, potentially, but that decision should be left to the Ministry of Finance. Now, so back to your question, Shant. So given that answer, given the fact that we know when you make taxes voluntary, a lot of people who are healthy will not pay. The solution to contribution is not population engagement. The solution to contribution is compulsory contribution. But population engagement is crucial to universal health coverage for other reasons. One, because yes, there's a trust question. If people have been using the healthcare system and it doesn't work, then engaging them in understanding why have you not used the services? What can we do to make services better suited to you is critical. We also find this is important when you set up a health agency to buy care, right? So if you make it transparent, you create a seat for civil society, for the population to have regular input into the benefit package, into which providers provide which services, is really important. Then, like Dr. Len had talked about, this engagement at the facility level, as they start receiving services, the regular feedback back and forth on, so we're implementing, what can we learn about your experiences? That is also critical, right? So I think population engagement is essential to the design, implementation, and evaluation. Population engagement, we have not seen globally as a solution to mobilizing resources through a voluntary means. Because if it's voluntary, people who are young and healthy will drop out of the system. That's what we have seen in countries across the world. So that was a very long-winded answer. So hopefully I didn't
Thank
lose
you.
you.
No, this is great. I was going to ask, well, first of all, before the next question, first, I just wanted to make sure that everybody is aware that there is an option to ask questions to our panelists. So please go ahead and participate if you have any questions that you would like to ask. I did want to switch back and ask Lena about how the reforms or how setting up the system looks like. She's back here. So Lena, based on everything that Adanna has just described about the reforms necessary or the philosophy behind financing this intervention, how are we doing with that in Armenia? First of all, do you agree with what has just been described? Second of all, if so, is this the path that Armenia is taking in terms of the broad-based funding or taxation? And third of all, where are we in that process? Do we have a roadmap or a timeline as to when we will achieve that necessary funding of the system?
Thank you, Shant. So let me start with your question on the patient involvement and readiness. So when we have just starting the process of talking about universal health coverage, we have started with raising information for the need of having such a system when people will reach their services without financial hardship at the time that they are receiving that services. We were talking a lot about universal health insurance system that we need to implement. By one point when the discussions were up, should we implement a tax for the insurance system, or we should go for the broad system, maybe taxing. So that there was a question if people will pay separately for this system. And of course, we were also doubting if they will do or not. Half, of course, they were paying already. So they, as Adanna mentioned, that they are paying from their out-of-pocket for the services that they are receiving at the time when they're already ill, when the disease is complicated already. There are many complications because they have not received their drugs at the primary health care. They have not gone for the screening project. They have not done any other preventional, steps to prevent the situation, because almost 60% of our people answered in the survey that they are trying to have self-treatment, asking neighbors or even pharmacies what drug will help them in case of the symptoms they have, etc. So, people already are paying a huge amount of money to healthcare providers, to pharmacies for their drugs, but they're paying very chaotically. There were no any, guidelines. There were no any system to push people to go for the primary healthcare service at first, to see their doctor. There were screenings. There are screenings now that we are now enlarging and involving some other new screening projects, but people also were not motivated to go to see their doctors regularly and to pass their testings. So, and this brings to the situation that they were paying a lot, but still this was not a successful case, because in very complicated, severe cases, we were losing these people or they were becoming disabled. So that's why we decided with partnership of American University of Armenia to have a willingness to pay survey among our people. And even in the beginning, I'm talking about 2021 maybe, when they have said that almost 2/3 of the participants of this survey answered that they are ready to pay for the services, services they need, and as a prepayment monthly, they're willing to pay. And this was very good news for us that people are ready, and we have decided, as I've said, we were trying to work on a healthcare system to see what are those challenges. Should be there prescription system, for example, should be protocols in place, people should be educated, healthcare professionals should be educated about these protocols, etc. And then we can go for the system. Connected with the taxation, broad taxation, this was discussed several times with the Minister of Finance. We have discussing the percent from the salary. We were discussing also the broad taxation, but the agreement, mutual agreement was that we will go for both. From one side, they will increase the taxation for some harmful products like tobacco. They have done it starting from this year. They have increased the taxing for tobacco products, but it's not as much as we have asked them. Still, we have a huge lobbying from tobacco industries, unfortunately, and this is not only in our country. This is a big tobacco industry, international lobbying system. And the mutual agreement was that the taxation will be in place to cover for those who will be paid from the budget. And these are mostly vulnerable population. These are elderly, these are kids and disabled people and poor people. But those who are working, they will pay by themselves a fixed amount monthly. But those who are receiving low salaries, government will subsidize even them with some 30 or 50% subsidies. So again, paying from the broad taxing that the government is doing.
Thank you. The challenge with moderating this session with these two panelists is that every time I have a question formulated in my mind to ask next, they've already answered it in the question from before. So thankfully, there are some questions that are trickling in the Q&A box here. But I did want to ask one last question from my end, and then move on to these questions. And it's a little bit of a loaded question, and I'm taking the right to ask it using my role as the moderator here. And that is the role of, we talked about essential healthcare services of quality. And within that, to me, it is undisputable that the foundation of that is primary healthcare services. And so I wanted to just take a moment to ask you your thoughts about that, and whether there are any ongoing efforts to improve the primary healthcare system in Armenia, upon which a high quality healthcare system can be built that not only provides quality care, but also focuses on keeping patients healthy rather than treating disease. Adanna Jan, maybe if you can start with this one.
Yeah, it's a really, I think this question is really important, and it's at the heart of our conversation on universal health coverage. We often found over the years I've worked, on this challenge in Armenia, we would often start with financing, but in the end, the financing is there to enable service delivery. And we know from looking globally that, an average of 80% of your healthcare needs can be met by a strong healthcare system. In many of the countries where we see better indexes on, say, health outcomes, etc., the primary healthcare system is stronger. And we have a clear definition for what that means. is a system in which the primary care doctor is your gatekeeper and your first point of call, first point of contact. And that person coordinates your care around the system, right? So it's not, I have a pain in my foot, I go see a podiatrist. You go to your primary care doctor, they have your history, and within the context of a history, they evaluate, do you need to see an endocrinologist because this could be diabetic foot? Do you need to see those kinds of things, right? To evaluate, where do I need to do to coordinate? And then there is continuity. We don't see you one-off, we treat fever, we treat a headache. We treat a person over multiple contacts, right? So we understand, first of all, so we know primary care is important. We understand the role primary care should play because we have seen it work in other systems. And then we have done a lot of work in partnership with the Ministry of Health, thanks to Deputy Minister Lena, to understand in Armenia, where are the gaps, what is happening, right? And the challenge with primary health care is both a quality and an efficiency challenge, right? I'm going to explain. So on the one, there are things Armenia does really well. Most people live within 14 minutes of a primary healthcare center, whether that's a rural ambulatory or a polyclinic. Distance is only a problem for very few people, maybe living in rural mountainous areas. That's really important, right? The overall, there are physicians, but there is a maldistribution. Most physicians are concentrated in Yerevan. But when you add nurses into the mix, there's usually a health worker there, in the facility. There's usually the average, equipment that are needed. It might seem far-fetched for an Armenian to imagine, there's no thermometer. But in some places I worked in Africa, you go, there's no thermometer, there's no sphygmomanometer. This is not the case. Right? You have some of those things. Now, the challenge now is when you think about, so what happens in that interaction? So if I get to this place and there's a doctor or there's a nurse, when I interact with them, am I diagnosed appropriately, right? So we did a study. And for some really complex things, the kind of things you should expect as a family physician, I have hypertension with lipidemia and obesity, or I'm a child that has severe malnutrition with anemia. So it's not one thing, it's multiple things. You're treating a human being, not the condition. We see diagnostic rates of accuracy of as low as 50 or 40%. And then when you look at the drop-off over time, so are you diagnosed? Then are your medicines or appropriate treatment is it started? And then is control reached? Some of those numbers for hypertension, it drops down to 10% of people who, following diagnosis are appropriately controlled. So then the key thing now becomes the kinds of things that Dr. Lena is talking about in terms of quality. It's things that we say we have a physician there, but how do we sort of regulate what it is they know, what it is they are doing? And I think in addition to licensing, there's a key question around the data around the interaction. Armenia is sitting on ARMED, this system that collects data. But that data is missing some pieces and it's not really used. Now that data can be such a rich source of information on what's happening in interactions, which physicians are delivering high quality versus not. Can we give that information to the population? Can we use it to decide how much we pay physicians? What can we do so that that interaction is actually making people better? But it's also, apart from a quality problem, primary healthcare in Armenia is an efficiency problem, right? The whole primary healthcare agenda. Now, we did a study to look at conditions that can be managed at the primary healthcare level, defined by WHO, and to see where are they managed in Armenia. And I'm looking at a slide on my screen. 36% are managed in primary healthcare. 13% get admitted in inpatient hospital. 50% in outpatient. So this is someone coming with something that could have been managed in outpatient, and that person gets a bed in 13% of cases. That is money spent that should not be spent. We estimated between 2017 and 2020, 27 billion drams were reimbursed for primary healthcare visits that could have been managed there, but were managed in hospitals. So, the work that is being done to strengthen primary healthcare is important for quality and making sure you have the right care for chronic disease, but it's critical also for efficiency, for savings and funneling resources away from overspending in hospitals, right, to other things. I'll stop there.
Thank you so much, Adanna Jan. So, Lena, if you can just comment on your thoughts about primary care and whether or not Armenia is embarking on improving and strengthening the primary care system. And let's try to knock off some of these participant questions here. This certainly is part of primary care, if I'm correct. Do we currently have preventative services such as mammography and colonoscopies? And do the patients have to pay for these preventative and screening services? And if so, I'm just going to add to this question, and if so, will that change under universal health coverage in Armenia?
Thank you, Shanjan. Actually, Adanna already presented the importance of primary healthcare in our universal health coverage system, but I wanted to also thank you, Shant, because we were happy to have you leading the primary healthcare reform in Armenia. And actually, you can talk more even what are those challenges that we have in our country, the primary healthcare level, and what we have decided to implement. Actually, coming back to your question on the screening projects, we do have a few screening projects here, currently in Armenia, and we are trying to enlarge them, but also to have more effective ways of implementing them. For example, the pap smear testing, this was implemented for several years, and it was started with the support of World Bank, but now our specialists are thinking to change the method of the screening, but for that we need to have the equipment in place, we have to have protocols, and of course trained personnel. But also to implement the universal health coverage, we are also adding new screening projects like the mammography, and we have started with the mobile mammography team, which is traveling through Armenia and staying in different markets and providing free services to women. At the same time, we are piloting other screening projects, but we have currently a working team in Ministry of Health, which is worked and developed the screening project with every detail. So what type of additional capacity building we have to do to implement this new screening list, what type of tests we need, what type of additional interventions we need to do. But talking again, coming back to primary healthcare importance, of course, if you don't have efficient primary healthcare, you will not succeed in implementation of any type of program for universal health coverage, because the primary healthcare should be the gate where almost 80 or 90% of problems should be solved, and then the high cost hospital services should be provided those who was not able to receive the services at the primary healthcare level. Over, Shanjan.
Thank you. Great. Thank you very much. Okay, let's try to get through some of the audience questions. Maybe we can ask for the answers to be brief so that we can get through as many of them possible and let everyone go to bed or work wherever they may be. So, question for Adanna. After financing is done, initial financing presumably, how should the cost of healthcare be managed, and how should the healthcare be paid in order to avoid rising costs such as what we see in the United States?
Well, I love this question. It allows me to talk about purchasing, which is one of my favorite things to talk about in healthcare. All right, so universal coverage, the way to sort of conceptualize it is we raise the money, we raise it in this way we described. It's not coming out of pocket when you at that point of care. Before you need the care, it's pooled. And that money is now used to buy services. It's used to buy services that are needed from specific providers, provided in a certain way. And that's what we call purchasing. This whole process where we have an entity that spends that money in certain ways now becomes your way of sort of nudging the system in specific directions, including in direction of lower cost, right? For example, in purchasing, you make a decision about what to buy. That's the benefits package. What are the things we call essential services? Now, in many countries that focus on private care, it's just, you're trying to make your package attractive. Even if this service is not essential, you're sticking in all these high-tech things, and then the package is ballooning and it's becoming more expensive, and so is the cost of care. Now, Armenia as a country can decide to do what other countries like Estonia, like Thailand have done, which is you have a system that is systematic that says, we're looking at the burden of disease. What are the prevalent conditions? We're looking at the key services that address them, which ones are cost effective. We're looking at which are the things that are painful to pay for out of pocket. And that now informs this benefits package. That becomes one way of controlling the cost. The other way of controlling the cost is decide what you pay for and who. So we just said 64% of conditions that can be managed in primary health care happen in hospitals. So the government should just not pay for them. If you don't pay for those services, and this entity is the big buyer of services, providers know, if you're doing this, it's really up to you, and they'll stop sort of providing it, right? So, it's purchasing is an important tool in that regard.
Great, thank you. Next question, maybe Lena, if you can answer this. I'm going to attempt to merge two questions here in the interest of time, and it seems like both the theme is making sure that gaps or disparities within the system are being addressed in universal healthcare. The first one is more on the urban-rural gap. Would universal healthcare create an obligation for the government to expand healthcare to rural areas and maintain the same quality regardless of location? And let me just add the second part by another audience member, which is, how do you make sure that the quality of care is equal in different facilities within the country? And a very interesting way of phrasing it is, how do you make sure that we're not going to overburden certain segments of the healthcare that already are delivering a high quality? So these disparities or these gaps, are we looking into addressing them and making sure that these gaps don't worsen along the path for universal healthcare implementation?
On rural and urban areas, for the first question, of course, the quality should be the same, but there is another question, what services should be provided at the rural areas and what should be provided at the urban areas. So at the rural areas, primary healthcare should be available for all people, with the same quality that is provided in the urban areas. And we have the same salary scale, we have the same licensing requirements for the facilities, we have the same protocols for the primary healthcare in urban or rural areas. And but I wanted to also add that currently we are working with the Asian Development Bank to do a master plan to understand in which rural areas we do need to establish a new primary healthcare units. Should it be ambulatories or health posts, but to understand where people physically cannot access the healthcare and where we have to establish a new one. And government has started a huge building project or renovation project, and across Armenia we are renovating or building new health facilities. And now because before it was only focusing on hospital care, unfortunately, now we are shifting on primary health care, and we do expect by the end of this year the results of this master plan, which allow us to strengthen the primary healthcare in all rural areas. Coming back to second question, it was on Shant.
It was about quality and assuring that the same high quality that exists in some institutions will also permeate through the entire system.
This is about the standards that should be applicable to all health facilities. For example, if we are talking about the protocols or guidelines that should be applied to all health facilities. If we are talking about the patient safety standards, these should be applied to all facilities. And it doesn't matter if it provides high quality or low quality services, there should be implemented standards that everyone keeps them and provides at least the minimal, quality of services to our people. Shant,
great, thank you. One question for each of you, and then I think we will wrap up. Sevan, I'm going to take the liberty of going over just by a couple of minutes. Adanna John, maybe this question for you, from and particularly important question. I feel bad that I didn't address it myself, and thank you for the audience for bringing it up. From a global and universal healthcare perspective, in a society in the middle of building its foundations, how do we conceptualize mental health care services, given what we know about the association between mental and physical health?
It's such an important question, right? And in most middle-income countries, if you look at the change in the burden disease over time, as they address child and maternal health, then not just the chronic physical diseases become more prevalent, the mental health issues become more prevalent, right? And I will say, I remember the first time I walked into that big psychiatric hospital in Yerevan, and my heart broke physically, because you could tell that, as bad as we're describing the challenges we're addressing are, that we, in the mental health space, we have just almost forgotten that space for many years, right? And I have to commend the government in recent years, at least beginning to think about how to do it, right? Because we kind of already know that, what strong mental health services look like. They're also focused on primary health care. They're not focused on institutionalization, right? And it's possible to incorporate, as we think about the benefits package, what is part of it, as we think about service delivery readiness, what providers can do, that they're ready to provide those services. It's possible to incorporate that into universal coverage. And I think it's imperative, given how high of a prevalence there is in middle-income countries like Armenia, right? So for sure, it should be part of the process, and I can see how it fits into the financing and to the service delivery packages.
Thank you very much. Nanushyan, perhaps this last question, I do see additional questions trickling with such important topics such as the patterns of over-referral and whether or not private clinics will be included in universal healthcare. We can go on and on because these are all incredible questions. But in the interest of time, and because I am certain that we are going to get a very strong answer, strongly positive answer from Lena on this one, I'm going to ask this and ask for her concluding thoughts, and then maybe just some final last words from Adanna. So the question goes as follows. It is clear that there is that universal healthcare is firmly on the political agenda, and we are in a window of opportunity to create change. However, given the continued geopolitical challenges, is there concern that the political will for this will fade?
Great question. This was even sometime a concern for us if we should go for that change for universal health coverage, having at the same time the border insecurity in our country. But there is a political will, and our Prime Minister, not once but in many times, mentioned that to have strong country, at first we should have a strengthened human capital in our country, and that's why it will bring also to more security at the whole. And this is not only healthcare but also the education. Two aspects, two fields now are the biggest target of our government, and you can see that at the education system also there are many initiatives. They are revising the curriculum, the standards, the guidelines. They are building new schools and renovating. They are implementing retraining for the also
Teachers,
yeah. But also through the education system, they are very actively working on healthy lifestyle promotion. This is also very important, and we are happy that our government is understanding the importance of human capital, how it can play, a role in rising the economic activity in our country, and how it can bring to more products and more results. One of the most important one, also the security for our country. Thank you, Shant.
Thank you for answering the question, and more importantly, really a heartfelt thank you for your incredible passion and dedication to not only this important reform of universal health coverage, but all things healthcare related in Armenia. You have served as an inspiration to many of us. Thank you very much. Adanna Jan, any last comments?
You're going to throw me out if I speak for too long. I would say just two things. this reform is going to be a really complex endeavor, and I think it has to be grounded in evidence. We look across the world, we see things that work, we see things that don't work. And Armenia has an opportunity to avoid, well-worn mistakes, like a focus on payroll tax. I'm just going to be explicit here, overburdening, focusing on hospitals instead of primary healthcare. There are clear things. And I see leadership from Lena and her team in sort of looking at the evidence and following the evidence. And I think we should bake data into the reform so that we're learning from Armenia as we're doing it and refining the reform as we go, because it's complex. The second bit is that I think the most important determinant of the success of this reform will be the friendship between Ministry of Health and Ministry of Finance. It is critical that both ministries learn to speak each other's language, understand each other's incentives, and shape messages with those in mind. So that's it from me. Shant, I'm leaving you with a bang.
Yeah, thank you. And Adanna Jan, having been present within those meetings between the Ministry of Health and Ministry of Finance, seeing you work your magic and with all of the fireworks make the impossible possible in Armenia, a heartfelt thank you for all of your contributions to this very important reform, as well as for staying up as late as you have this evening. So thank you for the both of you. And with that, thank you also to the audience for staying over now that we have run over a little bit. But let me pass it back over to Stefan for some concluding thoughts and give back everyone their evening.
As we wrap up, we are incredibly thankful for this chance to reflect and discuss. Thank you, Adanna, Lena, and Shant. For anyone who's interested, you'll find a link in the chat where you could sign up to receive the latest updates from Operation Armenia. Thank you once again for your participation and have a wonderful evening. Good night.
Thank you.
Bye, everyone. Thank you.